In the first episode, we showed case 3. What is going on with this tongue photo? Let me explain. This tongue is generally healthy. The bright blue color is artificial and is associated with lollipops, food coloring. Remember, any bright color coding is related to food coloring, such as candy, coffee, blueberries, or orange juice. The problem with this tongue is that beneath the bright blue color, you can see a thick white coat. The normal coat of the tongue is thin, white, and semi-transparent. This thick white coat reveals that this young person likes to eat sweets often, causing yeast overgrowth. Traditional Chinese medicine, TCM, developed in China. The origins of TCM can be traced back approximately 5,000 years, making it one of the world's oldest continuously practiced medical systems. Tongue diagnosis is an indispensable part of the inspection of the 4 diagnostic tools in Chinese medicine. It has been used at the beginning of every visit to observe or follow up on the progress of illness or the result of treatment. TCM has 4 main diagnostic methods. They are inspection, listening, inquiry, and palpation. Each part of the tongue hosts a vital organ of our body. A practitioner will observe the changes in colors, coating, shape and size, marks, moisture, movements, and sublingual vein status of the tongue. What does a healthy tongue look like? A healthy tongue is typically pinkish red with a fresh meat color, smooth on the surface with a slightly glossy appearance. It should also have a symmetrical shape fitting the mouth's width. The tip is in the middle of the mouth and free of cracks, sores, swelling, or indentations. A healthy tongue is primarily covered by a thin white coat, which is semi-transparent. The taste buds should be evenly distributed across the tongue and not excessively enlarged. Why does a TCM practitioner check your tongue? The color of an unhealthy tongue body can be red or scarlet red or dark red, pale, purplish, or bluish. The color of the tongue reveals circulation status and degrees of inflammation or infection of the body. For example, pale is a sign of anemia that could be low iron or low red blood cells. A bluish color reveals a low oxygen level in the blood. The color of the unhealthy tongue coating could be white or thick white, yellow or thick yellow, brownish or grayish black, with a wet, dry, greasy, cottage cheese-like mixture. For example, a brownish-black thick coat can be seen in a severe fever case. A grayish-black wet coat is often related to urinary or kidney conditions. The thickness of the coating indicates poor digestion, constipation, yeast overgrowth, microbial imbalance, or infection, etc. Let us check out 2 more cases today. Case 4. This is a 39-year-old Hispanic female seeking acupuncture for right sciatica and dysmenorrhea on November 2024. She is a truck driver and frequently experiences deep aches from the lower back to the right buttock to the leg in prolonged sitting. Her pulse, soggy, weak, but regular. Her tongue shows slightly peeling on the center with a lump on the frontal right portion and a thin white coat. The tongue color plus pulse did not reveal severe and chronic lower back pain during the movement. However, the lump in the right frontal portion of the tongue made me question if she had breast pain before menstruation. The patient responded that her breast pain was so severe, particularly in the right breast, that she went to see a gynecologist who told her it was normal. In Chinese medicine, breast pain is associated with liver qi stagnation. So, I gave her a Chinese herbal formula for 2 weeks and 1 herbal patch for the lower back pain. On February 2025, she reported that her breast pain was barely there before each menstrual bleeding. See the photo now. Case 5. What is going on with this tongue? The tongue photo shows multiple deep vertical fissures with a thin brown blackish coat on the back. We mentioned before that deep fissures indicate chronic or even constitutional issues. If the deep vertical fissures extend to the frontal 1/3, it is likely related to heart health. A brown or black tongue coat is usually associated with kidney or bladder conditions. In this case, an 89.5 YOBM returned for complex medical conditions. He has been coming to see me on and off for the last 10 years when he cannot get pharmaceutical relief. The patient's past medical history: diabetes type 2, hypertension, heart failures with 8 coronary stems in his heart, kidney dialysis 3 times per week in the past 5 years, 4.0 liters of oxygen 24/7, and degenerations in the lumbosacral spine. Pulse check: irregular and wiry, but worse on the right side.
Hello, I'm Dr. Dong, a practitioner of a Chinese medicine with over 35 years of experience. Throughout my career, I have developed a unique approach to assessing how by closely examine the tongue, a key diagnosis tool in Chinese medicine. When you are curious about your own health status, click the link below and share a photo of your tongue. Let's uncover insight into your wellness together.